Okay, you guys hope you're having a great day. Quick description of BodyTite. BodyTite is radio frequency heating underneath the skin. Saw some consults today and we discussed all the time, but why do we do that? We do that because when you do liposuction, this is the skin right here. This is kind of the fascia layer down here. If we were to do liposuction, you see the fat right here. If we suck out all the fat, but we don't do anything to these fibroseptal bands here, you can still have some skin laxity, and we want to prevent skin laxity in the future by radio frequency, using this radio frequency heat that warms up these fibroseptal bands. Here you can see the temperature gauge. We've talked about this, but you get around 70 degrees Celsius, 38 degrees Celsius on the skin, and that's all heat controlled with this device. I like to show this little video to our patients when we have them come in. What you see here in 10 seconds actually takes 3 to 6 months to occur, but it's these bands tightening down right there, and when they tighten down due to the heat effect, you get the skin to contract. And so last videos was showing you BodyTite. Now it kind of gets a little confusing. This is what patients are getting confused about, is that there's different names thrown out there. There's BodyTite, there's AccuTite, there's FaceTite, there's FemTite, there's Aviva. All those are the same type of modality, this radio frequency heat, but using different hand pieces. So here's the one called FaceTite. Now FaceTite came out, and we'll use FaceTite if we're doing a whole face or the lower face, and it will go over the entire face area, or the entire low face area, this whole area right here. But if I'm just doing a small little section, I'm actually going to use AccuTite, okay? AccuTite, small little hand piece. It makes a little smaller hole, and it's able to do smaller sections. So AccuTite is the smallest hand piece in the InMode platform for radiofrequency subdermal heating. That's AccuTite. The AccuTite small handpiece can be used in the vulva area. So this is just a picture of it showing being used in the labia majora. It can be used in the labia minora area. This is that small little handpiece. This whole, using this small handpiece in the vulva area, first done by Dr. Henry Ramirez, my buddy out of Oklahoma. He now goes around and teaches physicians everywhere on how to use this. I started doing it with him, was the second physician here, I think, in the United States to do it with him, and have seen some good results with that. This is used in the labia majora, labia minora area, and we're able to get shrinking of or skin tightening in this area, in the labia minora area, without having to do the traditional surgeries using the excision. So in conclusion, for radiofrequency heating underneath the skin, for skin contraction, there is the BodyTite platform, which we do have. It has different hand pieces. The BodyTite hand piece is this larger one. This is used for areas that are in the abdomen, the arms, the back, in larger areas. Then there's the FaceTite handpiece, which is a little bit smaller. This is the FaceTite handpiece, generally used just on the face or in the neck area. Also can be used on the banana roll area. If there's loose skin, I'll be doing that with a patient here coming up soon, you guys will see. And then lastly, the AccuTite's the very small handpiece that is used in the vulva area and smaller areas like the face, in certain areas of the face, nasolabial folds, above and below the eyelids, and so on. So the last part of the skin tightening process in most areas, not all the areas, but in most areas, specifically we're doing smaller areas, is to add Morpheus, especially if you're doing it on the face and the neck area. We do add Morpheus to the treatment if we need to get skin tightening, and Morpheus is like microneedling on steroids. We often do it if we're not, if we don't have a lot of skin laxity, we're not doing any liposuction, we'll just do Morpheus alone. So real quickly, Morpheus going underneath the skin, little pinheads that go underneath. It's like doing a microneedling, but there's that radio frequency heat. So that heat that's applied subdermally really helps with collagen production and skin tightening, more superficial, and then you're attacking the deeper layers underneath here with the radio frequency skin tightening, whether it's AccuTite, FaceTite, or BodyTite. So hope you learned a little bit here. That's the InMode platform for skin tightening, and it's often confusing because there's all these different terms that are used. But really, what it's doing is that this modality here, Morpheus, building collagens and helping with the skin texture. The AccuTite, FaceTite, BodyTite going underneath the skin and strengthening the fibroseptal network.